Okay. Hi there. I'm gonna come in, do my entrance safety check. I've raised the bed, make sure the patient is in semi-Fowler, so at 30 degrees. I'm checking my oxygen, so this would be up all the way, and they're supposed to be on 45% for the order, so that is on. I'm just gonna turn it down for sound, but it's bubbling, it's all connected, the tubing's on the trach. And then I'm gonna check that my suction is working. So we want it 80 to 120, so it's on medium, and it is the correct, oh my gosh, it's going down. Wait, okay, so it's correct. Then we can turn that off for now. It's all connected. And then we're going to check that we have our extra safety supplies. So we have our ambu bag and the tubing. We have an extra trach tube. We have the extra cannulas over here, along with the trach ties. And we would also have the dilators in case something goes wrong and we need to keep their airway open. And then we would also have the air measurer for the balloon. I forget what it's called. Okay, so now that I've done my safety checks, we're going to suction the patient. So, to do that, say, hi Jake, I'd let him know what's going on. I'm not sure if he can talk to me in this situation, but I check his wristband and everything. And so we're gonna apply a sat probe to his finger, because sometimes they can desat when we're doing this. They won't have the oxygen on all the way. And so I can select my catheter. He has a tube or a size 7 trach. So I think using the calculations we would want size 12 or 14, but all I have is a size 10, so we're gonna use that. So we're pre-oxygenating him, making sure that his sats are up and good. Going to open my packaging and connect it to my section. Get this ready. I'm not gonna open it yet. Keeping it sterile in the package.
And I'm also going to make sure that I have the suction catheter, so since he's wearing a 7mm,
I'm going to put on some
I would
gloves.
do the rule of the Trach 3 times 2, so I need a 10 French suction catheter, which I have here. This is a 10 French.
So we can just place this down a little further. Still get the...
But before I do that, I will have to oxygenate them. So I'm going to turn my oxygen to 100%.
Not turn it on. First we're going to insert. So...
And I have a pulse oximeter attached to my patient, and I'm going to make sure that his O2 is 100%.
We're just going to insert into the trach. In real life it would not be so bendy. Oh. Okay. I've reached the bronchodilator. Okay. I'm gonna say that's far enough, I guess. So we'll turn on the suction, and then using intermittent suction and turning it, we're going to take it out, making sure we don't do this for more than 10 to 15 seconds. Okay, good. And then we'll wrap this up, turn the suction off, and then I can dispose of this in my glove. Making sure to watch his sats, he's still doing good. And then I could also take the end of my tubing and put it in some sterile water, and that'll get rid of any like clots and mucus that I've sucked up to keep my tubing clear so I can keep using it. So we'll put his oxygen back on. Now we will do a dressing change. So I don't have a garbage bag here. I'm gonna grab some gloves here, and I have my dressing tray already set up. So, I'll put on my gloves. Going to take my oxygen off, just place it a little bit lower. forceps and get my garbage ready because I'm going to be taking off the old dressing. So first we're going to change the cannula. So I don't have the little ring that comes out, so I'm just going to kind of grab it from the sides with clean gloves, pull it out, and in the garbage I take off my gloves, change them, and we have our fresh cannula here. So we'll open that up. Okay, making sure to grab from the little ring. So we keep this part sterile at the end. We'll just insert it.
Now I'm ready to clean. I'm going to use cotton pick off
There we go.
to clean the bottom and top.
So that is changed. Next I can take off the old drainage gauze here. So I pull out with 2 fingers. I'll document what I see on my drainage sponge and I can toss that away. I'd also take off my gloves, re-clean my hands, put new gloves on, and now I can clean the site. So I'm going to take a Q-tip, dip it in some normal saline, and we're just gonna clean one swipe, the innermost part, that's the cleanest. And that we want to keep most sterile. Dip another one. And we'll go kind of from the top. And we'll go out a little bit more.
So now I'm going to get my rosette.
Slightly lower. Oops. That. Slightly more above. I can clean a little bit more outer. So I'll make a little rosette.
Lower your down, and I'm just going to clean a bit of that area as well.
Now we're going to clean the outermost part. Just one swipe.
Once again, stabilizing, trading clean.
Clean my forceps sterile here.
And now we'll just dry. Now I'll dry it.
And swipe on the most part here. And now we can dry the area. So, clean technique, dry underneath. And then we're gonna dry the top. Okay, now we'll apply the new dressing.
Now that I've cleaned it, I'm just going to look at the skin this side. I'm going to see how it looks, if it's macerated or if there's signs of infection.
Just trying to keep the innermost part the most sterile because it's what's going to be touching our tube here.
If it appears foggy,
So,
white. So
going to like this. It's okay if my forceps touch the side now because then they're no longer sterile. We don't have anything else that we really need to grab from our sterile field. So put those there, and then I can use my finger to kind of guide it up the side. Just keeping that inner part the most sterile.
So, if that were to happen in real life, how would this happen with
Okay.
So I have
I'll be checking his O2 sats, maybe give him a little extra. We also have in the order that we need to change his the ties for the trach, so we're going to do that next. That's a 2-nurse job. So today I will be playing all the parts. So we're going to grab our ties from the bag. Okay. close this so it doesn't get caught when I pull it through. So we're gonna take off one side first. I'd have my other nurse just stabilizing this in case he coughs or moves. We don't want anything to obstruct his airway or impair the integrity of the airway. Okay, so we're gonna pull this through. That's gonna put this through the back of his head.
So I'm gonna make sure that
Okay.
I'm not touching the inner area. So I'm just gonna
And I'm gonna pull this off. Again, I'd have another nurse here just stabilizing this. Pull it through. Just gonna put that through the other loop and make sure that it's holding this in place. Then we're gonna put this back on. Document, make sure that this is still at the correct inflation. I believe it's 20 to 30 centimeters of oxygen. And I can clean up all my supplies, lower the bed, and do my exit safety checks.